The state hopes millions of dollars will help close the gap in mental health care. Governor Polis signed a bill into law today to provide more integrated care practices where you can see a doctor and a therapist at that same visit. This new law provides grants of more than $35 million the first 2 years to help medical and mental health practices merge together, and $4 million in the second 2 years of that plan. Political specialist Sean Boyd joins us live tonight. Sean, the goal of this, of course, is to increase access for everybody to mental health care.
And Karen, we know integrated care works because it's been tested. In 2015, Colorado received federal grant money to facilitate the merger of about 350 primary care clinics and mental health practices. The result? More people got therapy and fewer were hospitalized. So when Colorado received COVID relief money, some lawmakers thought, let's expand integrated care across the state. At Tepeyac Community Health Center, treating the whole person is not just some catchphrase, it's a core function. The small clinic in Globeville has an equal number of doctors and therapists, and clinic director Dr. Pamela Valenza says they often tag team.
And then that behavioral health provider would then go into that room and meet with that patient in real time when they came in just to see their doctor.
That seamless handoff from medical to mental health provider has become a model in healthcare. Tepeyac ahead of its time. It began integrated care over 10 years ago.
If you're going to a health center that does not have that integrated care, what you're going to get is a referral. And that patient might call and they might have a 3-month, 4-month waiting list.
And many of Tepeyac's patients, she says, couldn't even get on wait lists because they're uninsured or underinsured. Even those with insurance have trouble accessing therapists. Representative Chris Kennedy and Senator Sonia Hawkes Lewis hope to change that by providing $38 million in grants to help practices integrate.
We know what the best practice is. We just have to expand that to the rest of the state.
We believe that this is such a fundamental thing to creating a better, more inclusive healthcare system.
A system that Valenza says saves money in the long run.
When we prevent hospitalizations, that person then can be a more functioning person within society, be able to sustain a job. And so it really has ripples across every socioeconomic plane.
The legislature allocated about $450 million in all this session to improve access to mental health care, passing bills to do everything from incentivizing people to become therapists to increasing the number of residential treatment beds in the state. Live at the Capitol, Sean Boyd covering Colorado First.
And this is a good time to remind you about our community conversation. It's tomorrow night as part of our commitment with MTV to Mental Health is Health. We are streaming it tomorrow night. I host this conversation. Sure hope you'll join us after CBS 4 News at 6 o'clock.